Hi, this video is a brief overview of the main findings of one of our recent studies. The study is titled Temperate Performance and Metabolic Adaptations Following Endurance Training Performed Under Environmental Heat Stress and was recently published in Physiological Reports. The brief background of the study is that many endurance athletes are exposed to environmental heat stress during training, whether incidentally or deliberately. Studies investigating the effectiveness of training under heat stress for improving performance in temperate conditions have produced mixed results, with the observed effects likely influenced by how the experimental training interventions were matched. Also, no studies have investigated skeletal muscle mitochondrial adaptations to a period of training under heat stress. We therefore recruited trained males to perform 3 weeks of endurance training in our lab. The participants were randomly allocated to perform their training in either 18 or 33 degrees. A fasted incremental cycling test, resting muscle biopsy, and metabolic and performance test were performed before and after the intervention period. The metabolic and performance test consisted of 2 hours of fed state constant load cycling, followed by a 30-minute maximal effort time trial. Training was performed 5 times per week for 3 weeks. 4 of the 5 weekly sessions were matched according to relative cardiovascular load, that is, heart rates observed at individual physiological thresholds in the pre-training incremental test, with 1 weekly best effort interval session. We matched the interventions in this way based on a recently published brief report from our laboratory showing that heart rates observed at individual physiological thresholds are consistent between temperate and hot environments, despite the loss of power with heat stress. Training interventions were performed successfully, with perceived training loads similar between the groups. As expected, power outputs achieved during training were lower in the group that trained in the heat. Our primary outcome measure was 30-minute time trial performance, which significantly improved in both groups. The magnitude of the improvement in performance was greater in the heat group after the erroneous data point was removed. Muscle citrate synthase activity significantly increased in the heat group, but not in the temperate training group. Citrate synthase activity is an indicator of mitochondrial protein content. The training-induced changes in citrate synthase activity and 30-minute time trial performance were also significantly associated. Gross efficiency during fed state constant load cycling improved as a result of the training, indicating less metabolic energy expenditure was required for the same power output. However, whether that reduction in energy expenditure came from reduced fat or carbohydrate oxidation was unclear. At group level, there may have been some tendency towards reduced fat oxidation after the training program in the heat group and reduced carbohydrate oxidation in the temperate group, but these were not statistically significant. Sports drinks ingested during these trials were labeled with high 13C glucose. Training effects on substrate oxidation were still unclear after partitioning endogenous and exogenous carbohydrate oxidation rates. However, a group-by-time interaction was observed for peak fat oxidation rates during the fasted incremental test, which indicated a reduction in peak fat oxidation in the heat group. In the muscle, no group or time effects were observed for content of sarcolemmal and mitochondrial fatty acid transport protein CD36. In summary, a larger temperate endurance performance adaptation was observed after 3 weeks of training in 33 compared to 18 degrees. This may have been related to effects on mitochondrial adaptation to training. Effects on substrate oxidation rates during exercise were unclear.